Your favorite procedure in pediatric dentistry?
Fluoride varnish.
Okay.
Easy, 5-minute thing, good money.
That's an honest answer.
Have to be able to communicate with your patient well. You should know your dentistry well because it is something that the patient is going to take home.
Yeah, you can't just be a good communicator and not back it up with good dentistry.
Now that I'm doing pediatric dentistry, we have to introduce something which is more kid friendly. Right from the patient entering, the whole ambience.
Like a kid's theme.
If not too much, a little bit.
A section of it.
Yes. Like I feel kids are much more easier to deal with than adults. Like you can do storytelling. They agree to you very easily. I mean, they do throw tantrums. And obviously time. I can finish a root canal and a cap in an hour. And वही adults में root canal के लिए एक appointment क्या?
For us, it's ulta. We can do root canals faster in adults, but for kids...
it's practice.
Hi everyone, welcome back to a brand new episode of the MADtherapy Sessions podcast.
Our guest for today is Dr. Sheena Soni. She has completed her Masters in Pediatric and Preventive Dentistry from Navi Mumbai. Dr. Sheena is the owner of Little Teeth Dental Clinic and is a consultant pedodontist at the Bridge Candy Hospital and the SmileBay Clinic in Mumbai.
The audio podcast is available on Spotify and Anchor. The links to that are in the description down below. Drop a like if you like this video and consider subscribing if you end up loving it. And also don't forget to comment down below your thoughts on the podcast. Till then, enjoy the episode.
Dr. Sheena, what are the common misconceptions in pediatric dentistry?
So the most common misconceptions that as a pediatric dentist I have come across is कि दूध के दांत है गिर जाएंगे या फिर they are like we are brushing, we are using the best of the toothpaste, the best of the toothbrush, but फिर भी my child has cavities.
Okay.
And so they need to understand that it is not only brushing or the toothpaste, it is more about your habits also. So we tell them कि when you're giving your child sweets, rather than giving them after dinner time, like as a treat, give them during afternoon, during the meal time, because that time the salivation is maximum.
Okay.
So what happens is the saliva will, and your second meal, because you have a meal after that, it will help to remove the bacteria or the food stuck on the tooth surface.
Okay.
So that helps. There is the parents, now obviously parents are so busy with work and all, they don't have the time. So the kids are watching TV and eating their meals.
That's with everyone. Every house, everyone is doing that. Very rarely you'll find someone who's not doing it.
Exactly. So then what happens is that 15-minute meal becomes a 45-minute meal and they'll keep the food in their mouth. Kuch aaya, and they'll just... So that allows more bacteria to accumulate.
Right.
Okay. So you will see kids, they have cavities they have food stuck on the tooth surface or in between the tooth. Okay. That is also causing... a lot of cavities in kids.
When should, a parent consult a pediatric dentist first? At what age?
So, see, ideally we recommend as soon as the first tooth erupts or your first birthday. During that time, that is 6 months to 1 year. It is
that early?
Yes, that early. Because firstly, the child can get acquainted to the dentist, to the environment. They have a familiar face to see. Okay, and also we can help the parent how to clean the gum pads or how to clean the first tooth, how to wean your child off breast milk or night feeding, because we've seen that night feeding is also one of the causes of cavities in young kids.
Okay.
It's basically like, when they are having bottle at night and they fall asleep.
Yeah.
Okay. So that milk remains on the tooth surface, especially the front teeth. Okay, that accumulates bacteria. Okay, and obviously in the morning is the time either they're brushing or they're just rinsing because they're too young. That can lead to cavities. You'll see white spots, you will see brown discoloration or black discoloration.
Right.
Okay, so like something which we try to educate the parents.
So parents whose kids are as young as 6 months should consult a pedodontist or either like physically or at least over a call.
We are pediatric and preventive dentists. Okay, so we try to focus more also on the preventive part of maintaining good oral hygiene, not only by just doing treatment, not filling and all. It's more about maintaining also for a long run, because after that when your permanent teeth come, वो तो हमको 50-60 years तक तो चाहिए.
बराबर.
So at this young age, how can you help? And also that anxiety of visiting a dentist is
Starts
something
reducing.
which we help in,
Okay.
removing that anxiousness, psychologically helping them to visit a dentist more often.
But someone has to tell the parents, right, that they
Yes.
need to consider a pedodontist. Has to be either the pediatric doctor, someone in the
So somewhere we have noticed that there is a little less awareness, amongst general physicians and pediatricians.
Okay.
That-
With pedodontist.
Like pedodontist, you can say teeth.
Okay.
Sometimes we have seen that it is like, it's okay. So I think that awareness needs to come more amongst general group of doctors
Right.
when it comes to teeth. Even for kids. Adults ke liye to there is, they obviously recommend, but for kids also. And I have seen pediatricians, they have this vaccine chart. Uske saath unhone, they have put another column of your first visits. First visit to a domat, first visit to an eye specialist, first visit to a dentist.
Right.
So that awareness has come, but I think it is much more needed.
Okay.
Yeah.
I mean, there has to be a direct communication between the
Yes.
pediatrician and the...
And a pediatric dentist.
Okay.
Yeah, so that is, I think, something that is needed, because young kids, like 2-year-olds, 3-year-olds
Yeah.
are having cavities. So it needed, I think the pediatrician can really help the parents, guide them towards this.
Because I've seen kids as young as 2.5, 3 having cavities. So how can you prevent that, or what can the parents do at home?
Yeah, so 2-year-olds, 3-year-olds, now I can give you 10 reasons of why they have cavities. It could be poor oral health, okay? Firstly, it could be giving treats. Ki if the child ka negative behavior, tantrum throwing and all, so they give, a sweet, child take you for this, I'll give you a lollipop, I'll give you chocolate. That has to really reduce. If you cannot stop, because we cannot stop a child from having chocolates and chips and pizzas, burgers, but we can definitely reduce that part. Also, I have seen now that kids are falling sick. Otherwise, they're more prone to antibiotics. And, so antibiotics also disrupt the microflora of the oral cavity.
Right.
Okay. So, uski wajah se we've seen kids having more issues. Also, there is, you can say, they are giving, one is night feeding.
Right.
We've seen 2.5, 3-year-olds are still being fed by their mothers at night. So they have to understand when to start weaning, what is the proportion of milk to water to help your child.
No, but the thing is, I've seen, say for example, like I saw your post on Instagram only, where you had mentioned about, teething, where kids, when they feel, the teeth are starting to erupt.
Yes.
Like there's a misconception that there might be fever, there might be...
Yes. So what happens is, teething is something when the child's teeth erupts above the gum line.
Okay.
Okay, that is teething. So there is a misconception or that it can cause fever or diarrhea. Okay.
Okay.
So it does sometimes cause a rise in temperature. That is fine. But if something is like 102 or 103 hua hai, so it is not mostly related to your teething. What happens is now kids are like they're teething, so they're very irritable. They want to put something in the mouth.
Okay.
Be it anything that is available. Either they'll put their own finger and they'll keep chewing or biting on it. And then your fingers are dirty. Anything on the floor is dirty.
Right.
Okay, so because of that, they can develop fever and diarrhea. And it is not only related to teething. Teething is not to make your child more sick. So that is something which I think is a misconception with respect to teething.
Can that also be because of thumb sucking, because they have dirty hands? And
Yes.
or
Yes. So thumb sucking for young kids, 6 months to 1 year is mostly to self-soothe.
right.
So definitely, if your thumbs are dirty, it can cause that fever or diarrhea or the child falling sick. That can also be one of the reasons.
Right.
So we say thumb sucking is okay till 4 years of age. So that is the teething time. So they teeth and they will put fingers or thumbs or anything that is available in the mouth.
So when that happens, do they need to get any certain instruments, certain
So we do have
equipments
for teething. So we you can have something which is readily available at home. Okay, you can give him a cold spoon. Put the spoon in the freezer for 10 minutes and just apply it on the tooth. It helps to really soothe the child. Or take a washcloth or maybe a soft cloth, wet it and put it in the fridge and just apply it on the tooth surface. That is also fine. You can give him cucumber or carrot which is cold, watermelon, cheese, anything that you bite on. And if your child is still, like we have seen teething start at the age from 4.5, 5 months also.
Okay.
And that time parents have not introduced solids. So you can give breast milk popsicles.
Okay.
You
get that.
So you get a popsicle where you can definitely put milk in it and put it in the freezer for 15 minutes and the child can just, suck on it or bite on it.
Okay.
Okay, so yeah, or you can make popsicles at home, whatever works. So you get these things. You have a juice measure, like like for oranges or something. You can just give it to your child. Even pacifiers help till an extent to, you get teether pacifiers also. So there are a lot of things which are available in the market and at home which you can do to help your child with the teething process.
Right. Another topic was fluorides.
Yes.
Which is a little controversial
It
currently.
is a little
What's
controversial.
your take on that?
So see, coming to fluorides now, there are two different school thoughts, you can say. Firstly, initially fluorides in India, okay, and in the US and all. First, initially fluorides was to be given after the age of 3. Okay. But there are recent new guidelines which say that you can start as soon as the first tooth erupts, that is 6 months to 1 year, under parental guidance, and that to a smear layer. Okay, smear layer is like very, very tiny. Okay, and under the guidance because your child is not able to spit it out. Okay, but so the CDC, that is your Center for Disease Control, recommended that you start giving fluoride to toothpaste after the age of 2, even after the recent guidelines. Only for this simple reason that your child might not be able to spit it out, ingest it, and all of that. So topical fluoride is needed because the kind of food that the kids are having today, it is very difficult for them to maintain. It is all processed food. Okay.
So you need fluoride.
You need at least for your teeth. I will not say take oral fluorides or tablets or water, but for your teeth, you need fluoride. So there is you can say a fluoride, sodium fluoride layer which is formed. Okay. So even if the pH is below the critical value, that is 5.5, the fluoride will help to fight the bacteria.
So that can be taken in the form of, say, toothpaste.
Toothpaste hai, then we do give certain mousse, or we have varnishes that we apply on the tooth surface. So these are certain preventive ways, for which you can help to prevent cavities in the future. So fluoride, personally, if you ask, it is needed for kids.
But up to an age, and after that, no.
Fluoride toothpaste, you can always start early. Varnish is something that we usually give till 13 or 14 because the teeth are still developing, the permanent teeth.
Right. So
they are little porous. So the fluoride, gets embedded faster. In adults, they do fluorides in adults. But, it is subjective. Like it is a person to person, how much do they really need it in adults. But with kids, you definitely need fluoride.
Because the current trend is, anti-fluoride. You should avoid fluoride.
If your child has good oral hygiene and if you feel ki my toothpaste is working, it is a non-fluorinated toothpaste. If it's working, no harm, you can use that. You can do one-time fluoride, you can do one-time non-fluoride. Perfectly fine. But at least understand that from your pediatric dentist or from your dentist. Should I change my toothpaste? Or what toothpaste should I give?
I think that's a better approach.
You can,
Just consult your
dentist.
Exactly.
Understand how is my child's oral hygiene or health. And then maybe introduce a fluorinated or a non-fluorinated toothpaste.
But that helps only till a certain age. After that, fluoride application won't do anything.
See, that is also something which is controversial.
Okay.
It might help, it might not help. So there are studies which have shown that it can help in adults. And there are studies which have said कि इतना नहीं फर्क पड़ा है.
Decreasing the sensitivity levels, something like that?
So that sensitivity, sensitivity can be, so we have toothpaste like, your Novamine or your hydroxyapatite. Okay, so you apply it with your finger and it helps to reduce the sensitivity part. Even fluoride, like we recommend this one toothpaste called GC Tooth Mousse, even for sensitive teeth. Because it forms a layer on the...
Even for adults?
Yes. You can give for adults. It is really good. Like there are a lot of companies and brands which have this desensitizing toothpaste with fluoride for adults. So they have shown, like you have to use it for at least 2 to 4 weeks at least to see the difference. It's very microscopic level pe, but it has shown good results.
Okay. So you also have your own private practice, and I wanted to know what are the key factors one should remember when they want to start their own practice.
I think it is very important that they understand the market in which, be the location, be the finances, what is the costing that people are paying here? What are your types of patients that are coming? How are you different for the 10 other clinics that is there,
Right.
So it is very important to understand the market, kind of patients that you're going to deal with when you open up a clinic. And you should have certain sets of skills.
Like?
Basically,
according to you, what skills?
Communication.
Okay.
You have to be able to communicate with your patient well. Basic skills of, you should know your dentistry well, because it is something that the patient is going to take home.
Yeah, you should.
Yes, you should. You cannot tell ki haan theek hai chalo.
Yeah, you can't just be a good communicator and not back it up with good dentistry. Yeah.
You can just be like ki haan chalo theek hai.
Yeah.
Ab 2 din baad aa jana, dekh lenge. That attitude doesn't work, especially if your location, then it's a word of mouth. Dentistry is all word of mouth, and so you have to understand, if you want to open up your clinic, you have to be upgraded. You cannot keep old way of working in your clinic. And
yeah, because that was my follow-up question for you. How do you keep upgrading yourself, as a clinician?
As there are newer systems which have come in terms of making impressions also. So you have scanners. Okay, you have, you can say 3D printers which have come. So you got to upgrade. You got to upgrade with respect to even your basic chair. Your, it has to have those facilities which is more comfortable to the patient. So that, and then if you look at, now that I'm doing pediatric dentistry, we have to introduce something which is more kid-friendly.
Right.
Yeah, so the whole thing, right from the patient entering, the whole ambience. So if you have something which is more specialized or more, you can say, for kids, or even for if you're doing only...
a kids themed clinic?
Yes. If not too much, a little bit.
A section of it.
Yes, which will help the kids, Yeah, so that is something which you need to understand when you enter this.
Yeah, because there's
open up a clinic.
Yeah, there's so many clinics around you.
Yes.
And the saturation, everyone keeps talking about the saturation. What's your take on that?
So it's very, our clinic is running for 8 years now. So when it started, I'll tell you this 100-meter range, okay? We had only 3 clinics, including ours. Now there are 7.
Wow.
And
that's still less, but
7 to 8.
Yeah.
In 100-meter range, it is, I feel it's more.
Okay. Makes sense. In 100 meters. Yeah.
It's 2 more.
Yeah.
It's a little bit. So, but still, I have seen that all the clinics are running. They're still doing well. There is something that every clinic is offering to certain kind of patients. Everybody is attracting certain kind of patients. Everybody has their own niche. They have something different to offer. So even if it is saturated, I mean, obviously awareness has increased among people ki we should visit a dentist. Teeth are something which is important. Everybody's doing it. Everybody's getting patients. So it is.
The population is increasing.
The population is increasing. Yes, that is the biggest factor.
And like I said, it's along with that, the awareness is increasing.
Awareness is increasing.
People
So
are
it is saturated, but you will still you still get patients. So that is fine. You have to be a step ahead.
Exactly.
Yes.
You can't complain because there will always be competition.
There always be.
You can change your career profession, there will be competition.
Yeah. I have friends who've changed career professions.
And they still face saturation.
Yes. I have had a clinic which has shut down. So there is competition, but that is fine.
Yeah.
I mean, you have to offer something different every time.
So you have done your master's in
Pediatric.
Yes.
And preventive dentistry.
And preventive dentistry. So why did you choose to do master's in that?
So my interest started in internship.
Okay.
It was just a simple joy. These tiny tots walking and coming. Doctor auntie or something like that, and creating smiles in kids. Like if you see, I have had kids. 4-year-old is coming and telling me, I want teeth like this. Every clinic has a picture of a smile.
Yeah.
I want teeth like this. And when they get it, they're actually looking in the mirror, oh, I've got it. So that simple joy, which I really liked when I was doing my internship. So that is when I decided I think pediatric is...
So you experienced
It's obviously love for the kids also. Yes, but...
you love the experience in your BDS days.
Yes, it is. Like, I feel kids are much more easier to deal with than adults. Like, you can do storytelling and, they agree to you very easily. I mean, they do throw tantrums. There are kids. But they're just so, easy to go with. And obviously time. Like, I can finish a root canal and a cap in an hour. And very adults may root canal ke liye ek appointment kya.
But for us, it's ulta. We can do root canals faster in adults, but for kids...
practice.
You always wanted to do masters? Or it's something which you decided later?
No, masters, I think I always wanted to do because I realized कि BDS के बाद there is something that I would want to upgrade.
Okay.
हाँ, सिर्फ BDS नहीं कर सकते. Then I realized कि masters भी ज़रूरी है. Then था कि कौन से फील्ड में करूँ and then in internship you get a hang of a lot of different departments and fields. So that is when I decided कि pediatrics and so I'm happy.
So what was the best thing you learned during MDS?
Best thing, I think patience. To be patient. Yeah. Patient, because kids teach you that. When a kid is crying or throwing tantrums, you cannot shout, you cannot yell, you can be loud, but you cannot shout at them. So you have to get another way around. So that is something which I have learned in my masters, which I even take it in my personal life. There are ways to deal with things. It is not only, you need patience if you want to, especially in this field, if you want to grow.
So if you can deal with kids, it teaches you having patience in life.
Yes, it does. Kids teach you so much. So if you have, it really taught me patience in life. So to be calm, to be more composed. Even if the child is throwing tantrums, you got to be cool. So that is what I have learned in pediatrics.
So according to you, what are the skills required to be a good periodontist?
Patience.
Yeah,
you need patience.
Yeah,
patience. Patience.
Okay, apart from patience.
I think you should, there should be a little fondness towards kids.
Of course, that
has to be there.
It's non-negotiable, yeah.
Yes, it's just that you should be ready. Every kid is different. You have to come with that thing ki, even if this patient doesn't go well or this day doesn't go well, it's fine.
Okay,
I think
I'll take that. So how was your whole MDS journey? Those 3 years, how was it?
It was rocky, but fun.
Rocky in a good way or rocky in a bad way?
It was because you had so much of submissions. There was so much of stress, to finish things, to deadlines थे, and BDS में उतना नहीं था, MDS में ज़्यादा था. Thesis complete करना है, LD complete करना है, prelims आ रहे हैं, patients, you know, because you need a certain kind of patients for your exams. तो वो stress रहता है. But otherwise the work environment was pretty good. Like obviously my batchmates were fun. So I had a great time, but yeah, you can say it was rocky but fun.
When you look back, like, because I keep asking people that, like, you know, who should do what in what. So example, who should do MDS in pediatrics?
Patience. If you have patience, if you like kids, or
No, but there has to be one factor which helps you, like, you know, like.
I don't know, because now I have started giving, like, even aesthetics is important in kids.
Okay.
Yeah, so I think pediatrics is an amalgamation of all the fields, but in kids.
Okay.
So you need to like all the fields, like ortho ho gaya, then endo ho gaya, prosto ho gaya, then even coming to lesions hote hain kids mein. So you need to like all those fields. You know, if you don't like ortho, don't take up pedo. Because you have to deal with
Appliances,
yes,
yeah.
you have to deal with appliances. If you cannot do root canals, if you're not too fond of root canals, then don't take up pediatrics. Take up some other field, you know.
Since you spoke so much about kids and patients, and like, any patient story you would like to share with us?
Oh, I have lots. Kids are funny.
Unintentionally funny.
So, I'm doing a treatment, okay, of a 3-year-old. And he's like, Doctor, I have to tell you something. So I said, हाँ, मैंने ट्रक चलाया. I said, very good. अरे बस मैंने बाहर ही खड़ा किया है ट्रक. 3-year-old is telling me this.
You have to play along with them.
Yeah, so I was like, okay, you know, there is a storytelling. So I said, अच्छा, कौन से कलर का ट्रक था? So he said, orange कलर का था. तो I said, ठीक है. तो I said, कौन था ट्रक में? नहीं, बस मैं अकेला था. मुझे यहाँ पे आना था ना, तो मैंने ट्रक चलाया. So these are some funny stories, you know, that, and I mean, it's fun, like, you know, or they'll come and tell you कि डॉक्टर आज, you know, 4-year-olds will come and tell, डॉक्टर आज ये नहीं करते, आज कुछ और करते हैं. या फिर मुझे ना वो ब्लू कलर का जो आप पानी देते हो ना, वो बहुत पसंद है. So their memory to things is like very different. And it's kind of nice, like every day.
But I'm sure there must be a lot of bad stories also. Like, I mean, not in a this way, but they must have troubled you also.
Oh yeah, they kick. They can throw tantrums. They can kick. So I mean, they come and tell you their घर का stories. कि घर पे क्या हुआ and all of that. And
Kalesh.
yes, and and the parent is standing in the front. Okay, and then it's something which I don't want to. No.
But I want to know also.
So one of my patients was like, so she was a doctor's kid. So she's asking me, Doctor, do you know how I was born? So and the father had come. So I said, yeah, there was a bird. He dropped you on, gave it to your mother. He's like, नहीं झूठ मत बोलो, मुझे बताओ मैं क्या. मुझे नहीं मालूम, आप मम्मी को पूछो. So मुझे starting से बताया, सर मुझे नहीं मालूम. So yes, there are sometimes where.
But they also put you in a very tough spot sometimes.
Yeah, fix.
Yeah, like.
क्या बोलो? But it's fun.
But I'm sure, like, you must be having a lot of heartwarming stories also, like, you know, when.
Yeah, so I recently had a patient who I had seen, 5 years back. And because I was a consultant in the clinic, so I usually don't share my numbers when I go in the clinic. So they actually found me and they're like, I want to come to you only after 5 years.
Wow.
Yeah. So that was something nice. Like, she actually found me on Instagram and she messaged me on Instagram and she's like, Doctor, it's been 5 years. I've been actually I was actually searching for you, couldn't find you. So now she's coming tomorrow. So I'm kind of really happy and they didn't go to any other doctor also. They waited कि कब ये ही मिलेगी. So that is something very nice. Like, that is something I was very happy that kid is happy. This doctor did a good job.
Any memory from your MDS days you want to share with us? Any conference stories, any, because
conference can be crazy.
But anyone in the department, anything like that?
So in the department, there were times, we were not in the mood. So sometimes we used to just hang out with kids. We are done with, adults. So we used to just hang out with kids, We used to ask them their stories. I remember there are only very less boys. We had only one boy, okay? And there was a time where it was very difficult for me to handle that patient. He must be 2.5, 3-year-old. And he was just not understanding.
Right.
My junior, picked up the kid. He made him sit on a chair and he's having this man-to-man conversation. कि भाई देख ले, बहुत important है. And this went for half an hour. And after that, the kid actually sat down.
Yeah, the boys.
Yes, the boys. I was like, क्या है ये conversation? What do you had with the 2.5-year-old? मुझे भी चाहिए. So yeah, there are, So it was nice.
Are there any things you wish you should have done more in your MDS days?
Yeah, I think I should have learned little bit more, like photography maybe.
Okay.
Because
you had a dedicated...
No. We just had to take from our phone. But I wanted to learn that skill.
Which you could have done in your MDS days.
Yes. I think that is something that I think I could have learned in kids also. They say ki zarurat nahi hai. But why you want to do it? But I feel it is because documentation is something which we should do. So, but abhi, the kind of practice that I am in, I have seen that, kids also want good smile. They want white teeth. So, to give that to them, you need to even document that well. So, I think that is something I would have. Even in my general practice, I need it. So, that is the skill.
Okay. So we go back to your BDS. How did you get into dentistry? So how did you get into dentistry? Why did you choose to become a dentist?
So dentistry was not my first choice.
Okay.
So I wanted to be an architect. Okay. So
very contrasting.
Yes, very contrasting. So I have a twin sister. Okay. So she wanted to do medical. Okay. So then I was like, okay, so I got down with architecture and medical, 5-year course. It is a paid job. Here I can be my own boss. So then, and parents also guide you. So then I was like, okay, I don't want to be a doctor, but I want to be a dentist doctor. And then she, you can say, she didn't get through medical, so she also chose dentistry. So now we both are doing dentistry.
Wasn't it weird, when you decided to tell your parents that we both want to become dentists?
I mean, they asked us why, but then I think they were okay because then we did a little research कि 9 fields है, उसके बाद भी you can study, you know. So then we were like कि ठीक है यार, school साथ में हो गया, college हो गया.
So when you entered college, dental college, how was people's response to you all?
Both of us?
Were you all okay because you all must have faced that in school, right? And in junior college. So I'm sure you must be used to it, but how was it in...
It was very good. We have done so much fun just being twins. I have given her proxies. I have done her patients also. So I'm a lefty, she's a righty. That is the biggest difference that we have.
Okay.
So, but I have worked with right hand. So I have done her patients also, basically trim karna ho, cast, aisa kuch ho.
No, so, but when you entered, first
they were
year.
So they कि अरे ये तो अभी आई थी, काम दिखाने के लिए, for DADH you do wax carvings, right?
Oh my God, it must be so confusing for the teachers.
अभी आई थी दिखाने के लिए, अभी 2 मिनट में फिर आ गई. तो he's like, I told you, right? ये करना है. So I said, sir, I've just come. He's like, he's also confused कि क्या हुआ? So then somebody told him कि sir 2 है हमारे पास. So they're twins. So my Viva was like that. I remember my first year Viva in DADH and medical में जो था, my 15-minute Viva was only on twins. I was very happy. कुछ और पूछा ही नहीं.
मतलब about y'all, like okay.
maternal, paternal, and they are like वो पिक्चर देखिए ना सलमान खान की, एक को पिंच करो तो दूसरे को दर्द होता है कि नहीं.
Bollywood ना यार.
तो ऐसा कुछ होता नहीं है.
ऐसा नहीं होता है ना?
नहीं होता है. Our understanding is different. That is the thing. But yeah, ऐसा पिंच नहीं होता है.
So who's elder?
I'm elder by 20 minutes.
But you are like identical twins. कितने twins थे?
We are fraternal twins, but we look identical. So this was my viva question.
So you explain that.
Explain. नहीं, but तुम तो same दिखते हो. तुम कैसे maternal हुए? Same egg से नहीं हो. I said, sir, अभी डॉक्टर ने ये बोला है तो. So this was my viva question. 15 minutes. ना DADH के लिए पूछा, ना biochemistry, कुछ नहीं पूछा.
So it's basically advantages for you.
Advantages. Yeah, good.
And then when you, along the years, like internship, final year.
Oh, even in MDS, because we were in the same college, so my department was in the basement. Hers was on the 5th floor. So there were parents, who were getting treated under her, and the kids were under me. So the kids when they used to go on the 5th floor, they're telling Shiba, "Hi, doctor," and Shiba is like, then she got used to it. Or they'll be like, when we meet in the corridors or some patient has met us, so they'll show us their OPG. They'll show me the OPG, or adult OPG. So I'll be like, "हाँ ठीक है, आप department में हो, I'm coming."
Yeah.
So that has happened with both of us, and it's fun. Like now we just enjoy that part.
Y'all enjoyed the whole.
Arey, completely.
Attention.
We do role reversals.
So, how was your BDS journey?
Fun. I think first 2 years थोड़ा understanding में है, little naive and all, but once clinical started and outside college, super fun. I think we could have done much more fun. It was good days.
Anything you wish you should have done more of in your BDS days?
Like clinical dentistry, वो थोड़ा I feel like I didn't do as much as I could have done.
Okay.
So I think that, and obviously I feel like there is a lot more fun that I missed, which I could have done.
Okay.
I didn't miss it, but yeah.
Could have
done more.
Which you can't do now.
College days.
Yeah. Also, like when you talk that it was a fun experience, how was the study part? How was it difficult for you? How was the staff, and how was the whole
experience? It was good. See, studies we had to do it. Choice नहीं था. करना ही था.
बराबर.
So there are like I never enjoyed the medical subjects. Like pharmacy and all was fine, but there was a point where it was so confusing कि सबका ही आंसर साइड इफेक्ट डायरिया और वॉमिटिंग तो है ही
बराबर.
तो वो तो यूज ही किया है हर वाइवा में. साइड इफेक्ट क्या है ऐसा, डायरिया वॉमिटिंग. बट स्टडीज तो करना था, बट आई रियली एंजॉयड द प्रैक्टिकल, लाइक द क्लिनिकल पार्ट ऑफ इट. लाइक आई रियली एंजॉयड. It was good dealing with patients. It is like a service, so it was something as a responsibility I enjoyed. And the faculty, they were good because I was a lefty. So for a lefty, your chair position, everything changes.
And we had very few left-handed chairs.
Yeah. And they used to really help out ki how you can position your chair, especially while extractions. Okay, they were very strict. But they used to be very helpful also, guiding through this, So that was fun. I mean, that was good.
Any one memory you can share? I mean, you have lots, but then any one which you can share with us?
Especially with my sister, Shiba, because we were twins. Okay.
So you all made pranks on people? Sorry.
I mean, they did get confused. So I remember कि हमको attendance देना था ortho department में. Okay, and because Shiva didn't come that day, so we had to go to the department and give attendance. Okay, as like a batch. When, third year posting रहती है, so sometimes you have to just go in the department and give attendance, and Shiva was not there. So the differentiating point at that time for people was our earrings. Okay, because we had different earrings.
So people knew that?
Yeah, okay. The staff knew that.
Okay.
So I gave my attendance with my earrings and my badge. and I removed my earrings. I didn't have her badge, but I removed the earrings and I gave her attendance also.
with her earrings.
No, I didn't have the earrings.
Acha.
But I just removed the
you
earrings.
just removed yours?
Yes, I removed mine and I gave her attendance. So that is something, and she got marked present. And you know, because our voice is also very similar.
Yeah.
So proxy karne ke liye, I've done that.
We'll get that definitely. Whenever she's back, we'll get both of you all on the same podcast. Just to because I mean,
if you look at us, you're like,
it's very trippy. Yeah.
Yeah,
like,
it is. तो बहुत like हम दोनों ने we have
apart
taken
from
it
a sister alone as an any
as lots of fun. Like, so I think we've had fun. I still remember the time in my car your hands got stuck. So yeah, in college, yeah.
Nithi was there in the car and just like,
Oh yeah, you remember, right?
Yeah.
That my Santro car, jiska the
Windows got.
the windows were only in the front, and
Nithi
you were
was
pulling it, and your hands got stuck.
Yeah, and Nithi was like, I think she saw.
She saw and she was like, "Ki theek hai?" And I was like, "Arey bol to sahi, tera haath adka hai." And you were like,
and then
"Nahi, nahi, chalta hai."
Yeah, when the car stopped, I was like, Nithi ko like,
You should have said.
I don't know, yeah.
So Arib, tell me, what is your fun in BDS days? I need one of your stories.
My fun.
Yes. My question to you.
I mean,
Your memorable fun part.
Apart
from the boys.
No, I can have 100 memories, but there was this time where we went on top of the Diva Patil, where the Diva Patil's
The logo
is there. So in first year and second year, that was like a thing where you, like, you know, you can't go
You
there.
can't enter, yeah. Not allowed.
Yeah, and in third year, we went there.
Huh.
We went just not on the terrace, we went on top of that board.
Yeah?
And we took pictures. Again, I'm sorry, there were only boys, but I think there was, no, I don't think there were girls there, but that's one, because that's something which, like, for example, whenever I go to...
Whenever you look at that...
Exactly, whenever I go Mahad, I have to cross the Diva Patil building, so that board is there.
Core memory hai.
So, that was one. Secondly, I think it's just the dental tree.
Oh, that was a
dental
thing.
tree
I think dental tree was a thing.
Yeah, I think that can be counted as like another member of our class, because
I think people knew dental tree more.
Yeah, and
Kidhar milna hai dental tree?
yeah, and lot of memories were made at the dental tree.
Yes, at the dental tree.
Yeah,
It was...
I don't know. I can have a podcast just on different memories.
You should get our whole alchemy together.
One day, hopefully.
Yes.
I'll try to. I don't know who all will come, because I'll have to segregate and keep people.
Oh yeah, but it can be a thing. Like we can have just a talk on DY.
But definitely they will come. I know they'll come. Definitely one time.
I think I've enjoyed the DPL.
Yeah.
I think I was a part of that one of the incidents that took place in Sanpada with you boys. Yeah.
It's okay, not a good memory, but okay.
So yeah, I was a part. So I've been a part of, like, especially during my internship days,
Right.
because we were part of the committee.
Yeah, and like when people say, like, I do ask people that, like, you know, what's one thing you should have done more? Of course, you should have done clinical more, but
it is
you should have had fun more.
More
because
fun.
that fun, you can never have that back in your
Yes.
life. Because now once you're married, you're working and everything, you can't
go back.
Yeah, 100 people in the same class doing, and very like-minded people.
Yes.
It was not a very like
we were on the same page.
Yeah,
Everybody
like
was on the same page.
it's
We used to bunk together.
Yeah, exactly.
Yes.
It's not like people are having fun and there's a group who are complaining to teachers.
Yes.
It's never like that.
Never
like that. And I still consider ours is one of the best batches.
Yes, I also feel that.
And just not based on my experience, based on what people have told me.
Our juniors, our seniors have also.
Yeah, even the teachers.
Yes.
So it's good. I mean, like I said, we'll have hopefully, like, I'll try to get as
We've
many
done
people.
mass bunking together.
Yeah,
the whole batch has
mass
showed
bunk
up.
exams, like.
Oh yeah, the mass
It's okay.
bunk exam.
Next time. So, when you look back at your BDS days, for example, if someone wants to make dentistry their career, or if someone's already in the first year or second year of BDS, what would your best advice be for them?
So I feel like when you want to, like, you should definitely observe under another dentist, you know. If
Okay.
you're planning to do masters or something, like, understand dentistry, not just ki patient karna hai, because there is much more to dentistry.
Right.
So when you're in your first, second year, you and have more fun also. Yes. But when it comes to clinical, you should know your
Should
base.
look at the larger picture
yes,
also, like.
your base should be very clear.
Right.
Because when it comes to making your patients understand certain things, that can only come when your base is very clear.
Right.
Like basics. And even with respect to fillings, like your basics of even mixing GIC, कब GIC यूज करते हैं, कब जिंक फॉस्फेट यूज करते हैं, ZOE कब यूज करते हैं, वो बेस क्लियर होगा ना, then it will really help you, like in the long run, not just completing your BDS or MDS, but even when you start your clinical practice. So it is important. First 2 years हम लोग बहुत grip करते हैं, but I
those
think
are the most important
yes,
years. Yeah.
you should know
Yeah,
how
and-
a tooth looks.
Yeah.
Like how does an incisor look? You should know the margins, line angles, everything.
What you learn in preclinical,
Yes.
you can't, like, because from third year you are gonna start doing on actual patients.
Actual patients.
You can't take risk on that.
Yeah, you cannot. So you should know your base,
Right.
your basics at least. That should be clear. So I think that is something for the first couple of BDS people you should.
According to you, is dentistry still a viable option as a career in 2023?
Yes, I definitely feel, because see, awareness has increased. Now there are newer systems also coming in dentistry. Okay, with respect to your scanners, digital dentistry hai. So there is so much of scope. Artificial intelligence
Yeah,
aa gaya
exactly,
hai.
you were mentioning
Yeah,
that,
yeah. So there is so much of scope that there is room for everyone, you know. So I think you can take it, but you have to understand that it is not something ki you have to keep upgrading also. Itna hi nahi kar sakte. You have to keep learning. You have to keep upgrading your skills. Go for conferences. Understand dentistry as a whole perspective.
Right.
तो वो important है if you want to take dentistry as your career.
So we'll come to our last section, which is the rapid fire section.
Oh, nice.
And I'll ask you a few questions. You have to answer as
Definitely.
fast as possible. Best part about, I think I'll reserve this for last, your favorite BDS posting.
Perio.
Please, why?
Perio was good. दांत साफ करना रहता है.
दांत के साथ पेरियो भी डिपार्टमेंट में साफ.
डिपार्टमेंट भी बहुत अच्छा था.
What was good about perio? Please, like.
So yeah, I found my husband there. So yeah, I like perio. It was good.
Okay. The next time he's on the podcast, I'll take out those topics. It's fine. One dental instrument or equipment which you regret buying or you have stopped using.
So I had bought these colorful composites.
Okay.
Okay, for kids, you know, different colors. You get they're flowable composites. You get yellow, green, pink, like a set. But with time, I mean, kids don't want colorful anymore. They want white teeth now. So that is something which is still.
So that was a
with me.
fad back then where you wanted.
Yeah, I mean, I thought that they would enjoy, you know, colorful, having a little bit more color in their mouth. But now they don't want it. So that is still kept with me.
Your favorite procedure in pediatric dentistry?
Fluoride varnish.
Okay.
Easy, 5-minute thing, good money.
That's an honest answer. Your favorite dental instrument?
I think a spoon excavator, like a good one. It has really helped me remove cavity in kids, like the caries part.
Avoid
And-
pulp exposure through aerotas also.
Aerotas also. And plus then, you know, for kids, it's always a storytelling. So I'll show them कि ये देखो ये worm है या कीड़ा है. You know, the color brown, it is because all the chocolates that you eat and all of that. So yeah, I like that instrument.
Okay. If you were not a dentist, what would you be?
I would have been an architect.
Do you still look back and think about it like
Not.
or are you happy with the decision?
I am happy because, I mean, Not much.
Okay.
Yeah, I'm kind of good with pediatric dentistry.
Okay. Your dream holiday destination?
There are lots. I think Antarctica.
Antarctica. He knows.
Sun lo.
One thing you wish to change about, dentistry in India?
Awareness has to increase, basically. Communication skills have to increase.
Communication between
The patient and the doctor.
So like a recall system.
Recall system.
Okay.
Yes, you have, and even documentation. We have not been taught all of this in our BDS or MDS days. How to document, how to compile and keep. वो थोड़ा I feel like होता तो
Okay.
That is needed. I think BDS में ही there should be a part.
Best part about the last one. The best part about being a pedodontist.
I think I just have this joy of kids, coming to you and sending them back with a smile, or the gifts part. Even the gifts is fun. They come, doctor, I want this gift today, and then you're also like, they love you. Some kids only come for gifts. So it's just the simple joy of giving back to the little ones. So that is what I really enjoy. The stories. I mean, it's just fun. Like, kids are just pure joy and pure innocence.
You give them joy.
Their stories are fun.
Perfect. So, thank you, Dr. Sheena, for
Thank you, Dr. Arib.
a small, lovely podcast. Like I said, like I keep saying, we'll again have you soon, because this was just like a quick intro of the different things you do.
Thank you so much.
And we'll again have you soon with hopefully more guests.
More guests.
And more topics to talk on. So, and I did learn a few new things about pediatric dentistry, which otherwise is difficult to, otherwise we are busy in our thing. So, but only when we talk to someone like you, a specialist like you, we come to know what is going on, and which we can share with the patient also.
Definitely.
So, thank you so much.
Thank you. Thank you for having me, Arib.
So, thank you.
Oh my God. Please edit thoda bahut.
You?
Kitna I fumbled so much.
That's okay. Even I fumble. That's fine. It's a podcast.